When I think of the march of cancer therapy, I sometimes rub my eyes and say, is this possible? It was so gloomy when I started. It was so terrible. All the children died with leukemia. There were no survivors. There were no survivors of advanced Hodgkin's disease at all.
When I started, more than half of the children who crossed the threshold died. Today, we cure over 80%, and in many groups, 90+%. So that's clearly the biggest change, and the most important one from my perspective.
We developed what we call the tandem transplant regimen here at the Dana-Farber. That's now the standard of care nationally. And the cure rates exceed 50% now when they were less than 10% when I started my career.
When I first came to Dana-Farber and went into oncology nursing, we didn't have many of the drugs that we had now. In the bone marrow transplant world, some of the drugs that help with the white blood cells, growth factors, didn't exist. So patients were in isolation for 4 to 6 weeks. Now maybe it's a week.
When I came here in 1980, patients lived only a few months. Now, many patients have myeloma as a chronic illness and grow old and die of something else. And on average, the survival of myeloma patients is 3 to 4-fold extended compared to when we started our research efforts.
It's hard to underestimate how different things are for patients with cancer today. We used to have a handful of very toxic therapies that worked in a small subset of cancers. And now we have dozens of treatments that are very effective and oftentimes give little or no symptoms.
In the future, we're going to continue to get smarter in terms of how we treat our patients, and we're going to have better agents, and I know we're going to make people live longer and we're going to cure more people. So that I'm looking forward to that.